Hi, I'm Harold Jenkins, Chair of the Martin County Board of County Commissioners. Our community has history of coming together to support each other during times of need. I'm asking each of you to spread compassion, not panic, and we'll get through this together. One community, Martin Strong. And I want to reassure you that we are ready for this. We have been monitoring, planning, preparing, and coordinating with our local partners, state and federal officials, and our not-for-profit agencies to deal with this pandemic. Today you will hear from the Florida Department of Health, Cleveland Clinic, and our county administrator, who will give you an update on the county's operations. Together with our partners, we're working toward a common goal of protecting the health, safety, and welfare of our employees, first responders who provide selfless service 24 hours a day, and our residents and visitors. You are our top priority. And I'd like to turn it over at this time to the Department of Health. Thank you.
Good afternoon. I'm Carol Ann Vitani. I have the privilege of being the health officer for the Florida Department of Health. The Department of Health has been working closely with the CDC to monitor the COVID-19 virus, and we have been actively working with our local partners for several weeks to ensure that the most up-to-date CDC guidance is quickly disseminated throughout the community. As of 11 a.m. today, there are 390 confirmed cases of COVID-19 throughout the state of Florida, 360 Florida residents and 30 non-Florida residents. Today, the Florida Department of Health confirmed one case of COVID-19 in Martin County. This is travel related. The case was identified through a drive-through Cleveland Clinic sampling. Our epidemiology team in Martin County has been in contact with the patient, who is doing well. And I would like to commend this individual for taking the necessary precautions to self-isolate following return to Florida. They will continue to self-isolate until symptoms improve. Prevention. Prevention is the best medicine. As we have said before, everyone has a responsibility to prevent the spread of this virus. Symptoms can appear 2 to 14 days after exposure. Most people, about 80%, will experience mild to moderate symptoms, which include fever, cough, possibly shortness of breath. The concern is for our older citizens with chronic health conditions. We have worked with our partners to provide extensive outreach and education to our area's assisted living facilities and nursing homes to ensure that our most vulnerable citizens are protected. Prevention is the key. The best way to protect yourself is to practice good hygiene, which includes frequent hand washing, covering your mouth when you sneeze or cough, avoid touching your face, staying at home when you're sick, and good surface cleaning. Also practice social distancing. Avoid mass gatherings in groups of more than 10 people. This does not apply to businesses or restaurant occupancy. Limited interaction, especially if you are 65 years or older and have a chronic health condition, and also as someone who is immunocompromised. There is no specific treatment for COVID. Patients receive supportive care, and there is currently no vaccine. All those who are collecting specimens continue to follow the CDC guidelines. We encourage residents to keep using prevention measures and monitor yourself for symptoms. If you become sick, call your healthcare provider for evaluation and to rule out other illness and stay home. At this time, testing by DOH Martin County is limited. County Health Department is limited due to collection specimen kits. Arrival of the collection kits is pending. DOH call center. The Department of Health in Martin County has established a local call center to answer questions. That number is 772 221-4000, option 9. That line is active Monday through Friday, 8 a.m. to 5 p.m. The State Department of Health call center is in place 24/7 to answer questions. The phone number is 1-866-779-6121. Residents can also email 24/7 at covid-19@flhealth.gov. The dedicated website is www.flhealth.gov. The website flhealth.gov provides information on confirmed cases across the state, prevention information, and more. There is also a dashboard featuring a map of the state of Florida with case counts in each county. And now I would like to turn this over to Dr. Petrie from Cleveland Clinic, Martin North.
Good afternoon. My name is Dr. Fernando Petrie. I'm the Chief Medical Officer for Cleveland Clinic, Martin Health. Given the contagious nature of this virus, we fully anticipated that there would be positive cases on the Treasure Coast at some point. We have been preparing for this for more than 2 months. As Cleveland Clinic physicians and leaders, we are holding regular multidisciplinary planning and meetings. As healthcare providers, our focus is to care for the well-being of our patients, our caregivers, and the organization as part of a greater healthcare community. We have been working closely with our public health partners at the Department of Health and the state and local levels. And we have been focusing on what we can control, which is screening patients, training and educating our caregivers, and making sure the hospital processes are in place to help the public and educate the public. None of this will change now that we have the first COVID-19 confirmed case on the Treasure Coast. We will continue to follow the processes and protocols that we have in place, and we are designed for the safety of our patients, our visitors, and caregivers. We encourage individuals that have been tested to continue to self-quarantine until they receive results. We encourage individuals to continue self-distancing as much as possible, hand hygiene, and to continue covering their face when they cough. We encourage individuals who are concerned that they may have signs and symptoms of COVID-19 to use our virtual visit platform, such as the Cleveland Clinic's Express Care Online. They can also call our nurse triage hotline between the hours of 8 and 5 p.m. That number is 772-419. If they meet the criteria, they will be given an appointment time at one of our drive-through testing locations, such as the one at Cleveland Clinic Martin Health North Hospital. And starting March 20th, we will begin offering testing at the Cleveland Clinic Tradition Hospital in Port St. Lucie between the hours of 8 a.m. to 5 p.m. Cleveland Clinic Martin Health started performing our drive-through testing on March 14th. And since that time, we have had 2,050 individuals that have been screened by phone to determine whether they met the Florida Department of Health criteria for COVID-19 testing. Of those individuals, we have tested 340 individuals at Martin Health North. Our objective is to identify the individuals most at risk and to ensure that they are able to receive testing by the guidelines that CDC is utilizing. By adhering to these guidelines, it has allowed us to be judicious in our utilization of resources, which are monitored daily, to ensure that we are able to take care of those that are most in need. From our experience so far, the phone triage process is helping us to do just that. And from the testing at the drive-through locations, this still remains an appointment-only process. It has been the most effective way that individuals who have signs and symptoms to be separated from patients in the hospital, the urgent care, and the physician's offices. We are grateful for all the caregivers that have been helping us out, that remain dedicated to patient care, and we will continue to do everything to keep our patients, our caregivers, and our community safe.
Thank you, sir. So, good afternoon. I'm County Administrator Taryn Krista. I would like to echo Commissioner Jenkins' opening comments. We are prepared to respond to this pandemic. Our first responders are prepared to safely continue their mission of protecting the health of our residents and visitors. Emergency management continues to engage with our local, state, and federal partners to make coordinated decisions and take informed actions. We are working with our nonprofits to help assure that all residents are able to find the resources that they may need. And the county is making adjustments to their operations to protect the health and safety of our employees and our residents. We have closed our library branches and canceled events, classes, and programs that were hosted by Parks and Recreation and our library system. In addition, as of today, the Martin County Golf Course is also closed. We are going to restrict general public access to our remaining county facilities to limit staff and customer interaction. And we're urging our residents, please, to rely on online, email, and over-the-phone resources. You can apply for a building permit, download ebooks, utilize our web-based library resources, and pay your water and sewer bills all online. We've also increased our cleaning and disinfecting in our county-owned buildings to protect our staff. We are heeding the guidance from the Centers for Disease Control and Prevention, the Florida Department of Health, and the Governor's Office to help prevent the spread of this virus. And we continue to urge our residents to follow these guidelines as well. And our final reminder that there is a wide variety of resources available to help keep this public informed about COVID-19. Our Community Information Center is staffed and ready to answer calls from 7 a.m. to 6 p.m. daily. That number is 772-287-1652. The Florida Department of Health call center is available to answer health-related questions 24 hours a day, 7 days a week at 866-779-6121 or via email at covid19@flhealth.gov. We also have up-to-date county information and a wide variety of links on our website at www.martin.fl.us/coronavirus, and we will continue to share information on Facebook and Twitter, so please connect with us. And if you have not already signed up for emergency notifications, just text Alert Martin to 888-777. So in closing, I hope we can all remember that this is a public health emergency, and we need to come together as a strong community and in response to this pandemic. And with that, we can open it up to questions unless someone has further comments.
I have questions for the Department of Health. Can you elaborate a little bit more on when this person, the positive case, was tested, how quickly the testing results were turned around, and what immediate action was taken once that positive result came in?
I don't have that information, and we don't disclose it and for patient privacy.
So you can't say when the person was tested?
No.
Can you give a little background on where they traveled to, since it was a travel-related case?
No, I don't have that information.
Can you talk about who qualifies to be tested on site of these drive-through tests?
Okay, well, the CDC has specific guidelines, thank you, which are changing relatively quickly. But currently, persons who have had close contact with a confirmed case, persons hospitalized with acute respiratory illness of unknown origin, history of travel to or from an affected area with widespread community transmission, history of international travel or cruise, those 65 and older with chronic health conditions, immunocompromised persons, and testing also is available per the recommendation of the physician.
What is being done at this point to check in with who the affected person may have had contact with?
So what you're going to do is you're going to make sure you repeat the question back to
Oh,
her
oh.
so that everyone can hear it.
Okay, I'm sorry, could you repeat the question so I can repeat the question?
Sure. What is being
So what is being done to find out who this person's made contact with during their travel? So our epidemiology department does an investigation, and they will, like I said, have been in contact with the individual, and they will learn from that individual who they've come in contact with and where, and then they will call that individual and recommend that that they may have been possibly exposed to a positive case, and tell them to monitor for any signs and symptoms.
If anyone has the criteria that you described,
Yes.
do they call their physician and have the physician call or drive through to make an appointment, or do they call themselves to make an appointment, or can they just show up and make an appointment?
Well, the recommendation. Oh, I'm supposed to repeat that.
Repeat
Sorry.
the question first. So the question is about testing.
Correct.
And so what happens is, your first call should be to your doctor
Yes.
to rule out any other illness. And then secondly, as you heard earlier from Cleveland Clinic, there is a triage line that people can call and get some information that way to see if they fit the criteria and can make an appointment.
Do I need my doctor to confirm that I needed an appointment, or can I just?
Well, again, we go back, whoops, sorry about that. So we go back to you definitely want to be in touch with your doctor first. You want to be ruling out any other illnesses. So that should be step one. And then step two is to go on to potentially the triage line to see if you may fit criteria through Cleveland Clinic.
And then they'll let me know if I can show up. On the triage line.
And they will make, yes, as the hospital folks have said, they will make the appointment with you.
Are there any discussions taking place about broadening the scope of that criteria, given that we are seeing more people infected locally and community spread is a concern?
Did you want to answer that, doctor?
Sorry, can you repeat that question
The
again?
question is, are we having, or are you having discussions to broaden that criteria, the scope of that criteria, since we are seeing more people, more positive cases in Florida and community spread is a concern?
So the question is regarding whether or not we're going to be looking at the possibility of testing patients that don't have symptoms because of the current number of patients that have tested positive here in Florida. Right now, we are following the CDC guidelines, and until those change, we're going to continue the testing right now for those that are highest risk. And when CDC gives us the ability to go and test asymptomatic individuals, we will do that. Understand that that would be considered mass screening. The need then for test kits, or in this case swabs and or transport vials, would increase tremendously. And so we need to make sure that there's a supply for the demand.
I think more specifically, my question is, we've come in contact with several community members who say that they haven't traveled, they've been ruled out for the flu, they've been ruled out for other tests, but their doctors are still telling them, well, I can't test you for coronavirus, but I think you should get tested. When will you start looking at testing those individuals?
Just a minute.
Excuse me, my name's Rob Lord. I'm the president of Cleveland Clinic. In a situation like this, it is the job of the regulatory authorities to establish testing protocol and processes. And then it's the job of the healthcare system and the 5,000 hospitals in this country to not go do their own thing, but to follow what they're doing. And as Dr. Petrie just said, we're following CDC guidelines. I'm sure there's a discussion happening at that level about the extent of testing that's available, but we will continue to cooperate with our governmental partners and test per those guidelines.
On this particular case, and I don't know if you're the best person to answer this, do we know if that investigation with the epidemiologist has already started with this one woman here in Martin County? And it's my understanding that it normally takes like 5 or 6 days for test results to come back. So should we assume that this woman was tested potentially up to a week ago?
That is correct as far as the testing time frame. And as far as following up with the individual, was that your first question?
Well,
What was your
is
first
that
question?
investigation underway?
Yes,
That's what we're
absolutely,
expecting.
absolutely. Like I said earlier, we've been in touch with the patient today.
And do you know if any additional testing was requested as a result of that investigation?
Not that I'm aware of, no.
Do you anticipate any additional testing?
Not that I'm aware of at this time.
Can you reiterate for the viewers who didn't hear the time
Yeah.
frame? What is the time frame
Yeah.
to get those test results back?
So the test results, depending on the, with our private labs, has been anywhere from 3 to 7 days, and that's, what we've been told.
Where is the private
Though the private labs would be, say, your LabCorp, your Quest.
So you send it to them and then they send it to their contracted lab.
That's
which
right.
would be out of state.
That's correct.
Let's clarify.
Right.
So the testing is being done at some private labs. And the health department has not sent anything to the private labs. So just so that we're clear about that, okay? And the results of the test, the time as to when they'll come back, really will depend on volume. So what is today, if there is an influx, that timeline could change.
But the person who tested positive was tested at the drive-through clinic in Martin County?
Correct. The person that tested positive did come through our drive-through process at Cleveland Clinic Martin Health North.
And that started on Sunday.
That started on the 14th of March. And I just want to reiterate something that Carol Ann said. We commend this individual for what she had done. She called the hotline. She did an Express Care online visit first. Then from there, went to the triage hotline to get an appointment. And that patient came in, was tested, and followed the instructions. She's self-isolated, has not been in contact with anyone outside her home, and she's currently self-isolating and following instructions from the Department of Health. So she has to be commended on what she has done, which is listen to her healthcare providers and follow the instructions. And that's what we want everyone to understand. Continue to do what your healthcare provider, the CDC, and the Florida Department of Health is instructing us to do.
Now, I've seen in other counties throughout the state that they show the age of the person as well as what part of the county they're from. Are you able to say what part of the county this person is from and their age or any information like that at this point?
Out of respect for the privacy of all of our patients, Cleveland Clinic is not going to discuss that information.
Are you guys concerned about anybody else being around that person? I know she was isolated, but before that time, is there any concerns from the county of anybody else contracting the virus?
Well, that's where the investigation comes in. So when the epidemiologist speaks with the patient, they will ask those questions.
Can you talk about the specific symptoms the person was feeling prior to going through that process to get tested?
I don't have that information, no.